please stay muted. So you entered this room, be muted, and bottom left corner on your computer or your tablet, I don't know, make sure that you stay muted. And we are being recorded, so if you have to go back to look at something, it'll be on our YouTube channel. So the first thing I want to do is I want to announce who I am, because I get a couple of emails once in a while of people sit there and say, well, you don't know, none of the speakers ever say who they are. Well, at the beginning. So I'm a patient, that's all I am. And I have a Zoom channel. I do play a doctor on Zoom once in a while, but I typically just enjoy hearing from all the experts and the doctors and grabbing as much information I possibly can to guide me through my journey. I was diagnosed in 2013, and I'm very fortunate. And we try to bring as much webinar information to you. And we also try to bring some self-help programming. And that's what I want to show next. So I'm going to share this with you guys. Didn't pop up right, but I'm going to go back. So this is our ALK Positive website. So I'm going to go back to the landing page. So this is our landing page for ALKpositive.org. ALKtALK is right here. That's all you have to do is click onto it, brings you right to the ALKtALK webpage, and you can join our Zoom room directly from this page, or you can hit our calendar like this. So this week we have a huge amount of programming. So if you want to go to the writing class, you click the writing class, they'll have a join button there. And if you want to go back up to ALKtALK and go into view past talks, you can go here, it'll automatically take you to our YouTube channel, which will have all of our past ALK talks. This is part 1 over here. We have 715 views, which is incredible. And bring it back to the channel here. Research is another button. The survey registry, the ALK Positive Lung Cancer Survey Registry is right here. If you click that, it'll take you directly to the longitudinal study. So those are the things I want to point out to you. And I think it's so important that we go ahead and bond together, communicate with each other, and do a lot of self-help with each other, a lot of workshops. I think it's amazing to get to know everybody. And I think what we'll do is I'm going to go ahead and launch some polling questions to get everyone kind of in the mood of what we're doing. So first question I want to ask this time is, what country do you receive your treatment? This is going to be a big shocker to everybody, I think. So Jeff, get ready. End the poll, share the results. All right, 86% of us are from the USA. Canada is 11%, and none of our European ALKs showed up for this one. So I'm going to stop sharing that one, and I'm going to go back, and I'm going to do the last poll question. Is, have you reached out to another doctor for a second opinion? And if you did through the ALK Positive second opinion program, please hit that one. This is kind of surprising to me, so I'm going to share the results. And 57% of us we have gone out for a second opinion. 41% says no, and 1 person went through the second opinion program. So I'm going to stop sharing that, and I'm going to go ahead and pass this along to. Well, first of all, I want to say this: these 5-part series that we're doing, we added a part. So we're going to have 5 total parts. They're all going to be together in our YouTube channel. Please pass along the information. If you see someone that joined, please give them the information that we have some 5-part series that they should check out. If you have a mentee, please pass that along also. And I'm going to go ahead and pass everything over to Summer Farman.
Hi, I'm Summer Farman, ALK Positive patient since June of 2020. I work with Mark on ALKtALK and the Healing Arts. Thank you so much for joining us this evening. Yes, this has been a long time in the making, and based on the YouTube views, we can tell that it's definitely something that is very well needed. Um, Also, use this as a tool too, like ALK 101 Part 1. I've been diagnosed with ALK positive lung cancer. Now, what you might be saying, okay, I'm so far past that. But how about a family member or maybe a close friend that wants to know more about ALK? What a great tool for you to pass along. Like, hey, watch this YouTube. This is what I'm going through. So that's one way you can use it. Then tonight we have Jeff Sturm, who will introduce doing assembling and managing your care team, which will be huge. Again, even if you're a seasoned patient, maybe you're thinking, do I have the right care team assembled? Um, and again, this will be on YouTube, so we can share it with our friends across the globe. And then as we're going along and brainstorming, and our medical committee teams are working on their portions. Colin Barton, who was doing part 3, he actually still is, but we switched it up because he found as he was planning, I'm progressing now what, which is critical for all of us, right? We need to be laying in those CT machines, knowing what's coming next, that we have a game plan. As he was doing that, he kept coming across a lot of vocabulary and lingo that maybe people weren't aware of. People say sometimes, what is NED? Or I'm stable, but I want to be more than stable. So I think there's a lot of words that we need to go over, and vocabulary. So as of now, we've switched it up. We added another part, and we're so grateful to Colin for doing that. And it now will be ALK 101 Part 3, Cancer Lingo, what does it all mean? So that'll be a review of everything that you might hear your doctor say, or you might see in research papers, different mutations, all sorts of things. And that talk will be critical. So that will be in 2 weeks. And then where we added the talk was on the 23rd. And that will be ALK 101 Part 4, I'm progressing now what? And then on the 30th, we have Emily and Mark doing Life After lorlatinib. So that will stay the same. That will still be there. So Emily Venanzi and Mark Muscovich. So we'll continue to send out our emailings and keep you updated. But yeah, we just wanted to let you know of that change, and you'll have a 2-week break, and we hope to then see you there. So I'll see y'all again in a little bit during the Q&A. And Mark, anything else before we pass it off to Jeff?
Just put your questions in the chat feature, and Jeff, let Jeff do his presentation, and we'll circle back. So, Jeff, the microphone's yours.
Ready to go. So good evening, everybody, or afternoon here in California. It's great to be here with y'all. And we've got about 45 minutes of a presentation talking about assembling and managing your care team, as you all know. So I'm going to share my screen. Everybody see that?
No.
Nope. Hang on. I figure. Can you see that?
Yes, now we're starting to say something.
Okay, there you go. From the beginning. Okay, there we go. Got that? We can see that?
Yep.
So I want to start out by saying that this is a patient's perspective. I am a patient, ALK positive patient. Been at this for 8 years, 3 months, and 2 days. You learn a few things along the way. It's definitely not a medical professional. And it seems to me that the only way to learn how to navigate these waters is by going through it yourself, or borrowing the information from other people, learning from other people. And these are my perspectives I'm going to be talking about. They're not necessarily facts. Some are going to be opinions, and some will be my beliefs. And I'll try to sort out which are which as we go. I am an ALK Positive volunteer, ALK Positive Inc. volunteer. I'm on the Research Acceleration Committee and the Clinical Trials Committee. And that's a qualification that I'm pretty proud of for the most part, because my role there is to listen to some really, really smart people. I mean, there are PhDs with, medical degrees and MDs and pharmaceutical industry professionals on these committees. And, I'm a business guy. For the most part, I try to follow along and figure out what they're talking about. And I've been doing it for 2 years. So, you kind of go to enough meetings with these people and the biotechs that we call on pretty regularly. You tend to pick up some of the language along the way, and you may have seen some of my write-ups as we go. I'm also really proud that I was asked to be the ALK Positive patient representative on the University of Michigan's advisory board with our Director of Research and Clinical Affairs, Ken Culver. And that's an interesting place to be and great for the learning curve. A little history for my credentials. My wife has been a breast cancer patient for 12 years now, diagnosed in 2010, heavy duty surgeries along the way, heavy duty chemo, multiple recurrences. She's in great shape now, getting ready to do surgery for lymphedema in her right arm. They can actually repair that these days. So she goes through the same thing ALK Positive patients go through. She gets scans every 3 months. So she takes shot every month. She takes pills every day. She's doing great, very much like us, but she's living cancer just like we are. And, I was diagnosed in 2014 and went through the crizotinib and a whole lot of radiation at that time. Switched over to alectinib, and I'll tell that story in a little more detail later. I got 6.5 years out of alectinib, and now I'm on lorlatinib for a couple of years and doing well, doing fine. Had a lot of trouble with side effects, but that's behind me. I'd like to say when it comes to generating and managing your care team, there's no one right way. There's your way. So I'm going to offer some advice that sounds like a lot of people on this call already think is pretty good, particularly about the second opinion program. But understand that there's a whole range of the way to support yourselves in this world, and there's no hard and fast rule. This is Americans' perspective. I was expecting we'd get some Europeans, and looks like we haven't. I'm glad we asked that question. So I can't speak for Canada, but I can speak for the US. We are all cancer patients that attend certain clinics, and we have certain oncologists. I would like to ask the question, like everyone, to ask themselves the question, how did I find my clinic? And how did I find my oncologist? Was it a rational choice process? Did we shop around? Did we look? Or was it the path of least resistance? It's just what happened. I don't know that we're all that rational when we're first diagnosed. You kind of take one step at a time and you move on to the next thing. Was it a simple referral? How did we come across the clinic that we're being treated in now? And how did we wind up with the oncologist? Hopefully, you like to think it was a rational choice process where we really did evaluate all the options and, have some kind of rational criteria. But most of us, I think, don't. And then I'd like you to ask yourself the question, is there room for improvement in the way we're being treated now and with our oncologist, and is there room for improvement with the clinic that we're dealing with? And to speak conceptually for a minute, self-advocacy is kind of a continuum. On the one hand, you've got the folks that give me my treatments and keep it simple. That's my wife. She doesn't have much interest in all the medical stuff. She doesn't care to get on a forum. She understands that you have to navigate. She understands the second opinion program kind of issues. And she doesn't think about her cancer, literally. I mean, she gets her scans done, and if nobody calls her to give her the results, she doesn't chase it down. You know, they call her if there's something wrong. There's no two ways about it, but she doesn't really think about it much. I, on the other hand, am exactly the opposite. I want to know everything, every little last detail. And I'm intrigued by the facts, by the science, by the very, very interesting people that we've met in the cancer community, and intrigued by the power of the mission some of these folks are on. And I want to know. And frankly, I've learned enough that I can actually make a contribution back, which just feeds my interest. But the point is that there's a broad range of self-advocacy. All of it's workable. It's yours, and be it what it will. And parallel to the same issue is the question of who's in charge of your treatment. There's a range of patient involvement, and it's based very much on how much you know, and how much you don't know. They're those people that just tell me what to do. I don't want to argue about it. I don't need to know a whole lot. I'm not going to question your judgment. I'm not that interested. Just tell me what to do. And people do fine. I mean, obviously. Or there's the attitude that you are the manager of your healthcare team and activities. You are your caregiver. You know, some of us on this call are experienced at hiring people. I mean, we've all hired plumber or electrician or gardener or whatever. I was an entrepreneur. I hired a lot of people over the years. I'm used to people working for me, and conceptually, my lawyer works for me, my accountant works for me, and my doctor works for me. Now, my doctor doesn't necessarily think that. I'm very sure that they work on their own, and that she's in charge. But when it comes down to the decision making, I'm going to make those decisions, and that's very much the opposite end of the spectrum from just tell me what to do. And it goes along with knowing as much as you can. I am going to hypothesize that the more skillfully you manage the medical process, the better you may do. There's a skill thing about keeping yourself alive with lung cancer. And there's a lot you can do to improve your state of being. The first thing, and I think is by far the most important, and Summer touched on it, of having a game plan for the next stage of your treatment, is to prepare for the moment. You know, a lot of people that have never gone through a recurrence kind of arrive at the moment unprepared, and it's scary. You don't know what to do. We see people on the forums, and I know people that have bounced around quite a bit at that moment, just frantic, trying to figure out what to do. And I'm going to suggest that, unfortunately, that moment is probably coming. So it's better to know what you're going to do when it happens beforehand. And that's about education, is understanding your diagnostics, your blood tests, your biopsies, your scans, reading them, knowing what they say, and really getting into the nitty-gritty of them, certainly particularly at recurrence. Know what your next treatment alternatives might be. Find out, think it through, find a way to know what the roadmap is ahead of you, so that when things happen, you know exactly what to do. And it's not so scary. It's still going to be scary, but I would also suggest dealing aggressively with side effects. You know, the people are on full dose of alectinib, and their body's killing them, their joints are killing them. You know, you can do things for that. I'm going to talk about a couple of things, but one thing you can do is reduce the dose. Obviously, some people do, some people don't. We've seen people on lorlatinib that are, really having trouble cognitively on the full 100 milligrams, where 75 milligrams might be completely fine. Dealing aggressively with side effects may mean getting medical help from different providers, and that's one thing you can do to make it better for yourself. I think of the concept of exquisite compliance, which to me means show up for everything. I'm right on time with all my scans. I've had 34 PET scans so far, and I haven't missed a one. I get my results right away. I show up for the blood tests. I'm on time for all the appointments, even though the doctor never is. I take all my pills. I miss maybe once a month, and I always feel terrible about it. But working your treatment plan with great precision is important. A lot of people don't, I'm told. Another option you have, and this is a very important part of my talk tonight, is that you have the option to upgrade your oncologist and or the clinic if it's called for. The good news about ALK is that we have time. And if you're not happy with your oncologist, if you're not completely happy with the clinic that your oncologist is integrated within, then there are other options around. We're going to talk about that. And you may be completely free, given your insurance, that's another issue, to go somewhere else. It may not be. I'm also going to suggest, it sounds like a lot of you have gotten established already with a second opinion ALK doctor. Those of you who have done it know exactly what that's about. There's nothing like an ALK, serious ALK expert, particularly the group that we have in our second opinion program in the ALK Positive organization, to guide you at the moment. Prepare for the moment. I'm going to talk about that as the biggest thing you can do. And some people, particularly that favor the just tell me what to do, don't necessarily drive the process. They don't follow up. And I'm going to suggest to go exactly the opposite way, to take initiatives to improve the expertise and effectiveness of your providers. I have a local oncologist, not my second opinion oncologist, a local oncologist. It's very competent. She cares about me enormously, but she doesn't know much about ALK, and she sees all kinds of patients. So I bring her everything. She gets a little frustrated with it because it's frankly over her head, but I bring it anyway. So there you go. And it's important to be the one that gets things moving. If something's stuck, a prescription's stuck, or an appointment is stuck for getting scans, or your scans haven't come back, get on the phone, bug people. If you can't get an appointment, ask to be on a waiting list. Call them every day, see if somebody's canceled for today. Do things to get things moving, particularly at that moment during recurrence when you have to fight it out a little bit. And then, of course, preparing for the moment, be steps ahead of the process. Know where you're going when the time comes. And in the meantime, enjoy yourself. And of course, learn as much as you can. Continually do your own research. I know a lot of people don't necessarily go on the Facebook site. I have trouble going on there because it's tough seeing what people go through sometimes with lung cancer, let's face it. But I'm going to talk about the criticality of going there, particularly in those moments of disease recurrence. And getting to know that the support group is family. There's a ton of information on the ALK Positive website that is invaluable, and I encourage all those people that really want to be fully informed to browse around in there and read what you can. And of course, you're all attending ALK Talks as it goes and review the videos and ask questions all the time. the support group is great for questions. I mean, you ask a question. I had a question about cholesterol. I put a question out there, and I got like 12 answers within an hour. I mean, it was just great. That is a cultural phenomenon to have the Facebook platform to begin with, and then all of these patients that have been through it already to be able to answer your questions. I think this is a spectacular phenomenon. When I first started, when my wife Ellen started with kids, there was no resource like that. So that's kind of a treasure that we have as a culture, and I just think it's great, and I really appreciate the people that run it. Be ready when the moment comes by positioning yourself to make the informed decisions. You should, I don't want to use that word. It would be useful to be in a position to be deciding collaboratively with your oncologist exactly what the next steps of your treatment are when the moment comes. You should know as much as they do or more. You should. It would be good if you can, and be in a position to make your own decisions. And we're going to talk about the two oncologists game plan. Apparently, a lot of you folks already know that. One for local ongoing care, and then one for expert second opinions upon disease events. And I'm going to stop share for a moment. I'm going to take a risk and come back here with my face and everybody else's faces and tell a story. So when I was first diagnosed in 2014, the local oncologists had never heard of crizotinib, and frankly had never heard of ALK positive. And they started me on radiation. I got 32 days of severe radiation burn in my chest. It wasn't a lot of fun, but about day 28, they got the report back from the genetic testing and said I was ALK positive, and there was a drug for it. So my oncologist called me up, was very happy that we got a drug for you, and it worked. It knocked it out, but it only lasted 7 months. At which point, my doctor said, "Well, I mean, you're going to have to do chemo now." And I got on the forum. There was a precursor forum. Mark, what was the name of that forum?
Inspire.com.
Inspire.com. That was before the ALK Positive forum. And a really nice man by the name of Phil Trahan, whose son Andy, late son Andy, was an ALK positive patient. He said, "Call me up here in Louisiana. I'll tell you how the game is played." Well, game is played. Okay, so I called him up, and he told me, "You need to talk to this doctor at Massachusetts General." Happened to be Alice Shaw. 4 days later, I was in Alice's office. She said, "There's a trial that's perfect for you. You're right at the end of the trial. It's expanded use now, and this is what you need." So I did, and it saved my life. So there's two elements there. One is that I accessed the website. Two is I accessed the second opinion. Now, later on, I regressed three other times. Second opinion overrode my local oncologist all 3 times, and I'm still here. So now I work with Ross Camage, and I'm delighted to say that's one of the great relationships in my life. So I am going to go back to screen share with any luck. Can you see that? Somebody say yes?
Yeah, you're good to go.
Okay. For those of you who are not familiar with second opinions, they're normal course of business, cancer world, done all the time. You can get an oncologist that gets offended by it. My first reaction is, well, too bad. But it needs to be handled diplomatically sometimes. I did have, I also have prostate cancer. I forgot to mention that, but I was dealing with a replacement urologist for my original urologic surgeon. And he got offended that I was going to UCSF for second opinion. He said, "What do you need me for?" And I said, "You're my local guy. I mean, you're the guy." And he didn't quite get it. So I had to leave him. You know, I really couldn't get there with him. But with my main oncologist, you know, lung cancer oncologist, you know, she's finally learned to get it. And now she says, "Okay, what does Dr. Camage think?" Which is, you know, took me a few years to get there. Your oncologist should be happy that you're getting a second opinion. And the smart ones, the mature ones, will want to know what the second opinion says, because they want to learn just like everybody else and want to take care of you. There are lots of cancer care facility types in the US. There's the NIH, National Cancer Institute designated cancer centers and affiliates. And at this point, I'm going to pull that up if I can. Yeah. So there are lots of comprehensive cancer centers around the United States that are certified by the US government and the National Institute of Health as National Cancer Institute cancer centers. And one of the things I think is really interesting is that patients are treated at these cancer centers live longer. So Fred Hutch Cancer Center in Seattle study, but there are other studies that parallel this. The standard of care is higher. They know what they're talking about better. If you can find a second opinion at a national cancer center, it's to your benefit. And one of the things I've discovered, people think I know a lot about cancer these days. And when my friends get cancer or their relatives get cancer, I get called. And I say, go to a national cancer center and get on their website and find their second opinion program. So recently have a very close friend that unfortunately contracted glioblastoma. And she was treated at Kaiser. They wanted to put her, they quickly did a surgery, like within 2 days, which is, you know, hang around for a while and we'll figure that out for a minute. But they wanted to put her in a clinical trial that talked about 2 drugs. And, you know, they called me and asked me what to do. And I said, you know, she's 100 pounds overweight with lupus. You need a second opinion. And we got on the UC San Francisco, University of California, San Francisco website, their designated cancer center, and found glioblastoma second opinion program. And they got their health records over there within a couple of days electronically from Kaiser. And within the week, they had a written evaluation of her case. And they very firmly said, you do not want to do that clinical trial because it's 2 very powerful drugs that are normally used sequentially rather than at the same time. So we do not suggest that. So that turned the Kaiser people around. And, you know, all we did was get on a website. I've done that another time with another friend. Just got on the website, found a really great doctor, got a second opinion really fast. It's one way to go about it. And I think it's another of the great treasures in our country that a lot of these designated cancer centers have second opinion programs that you can just dial up online, which is really kind of great. Another great place for cancer care, that's university affiliated research hospitals and their branch locations. A lot of these are designated cancer centers. There's a lot of overlap right there. Local and regional nonprofit hospital facilities can be very, very effective. Where we live, we have a great one, John Muir Hospital, Walnut Creek, California. And then, of course, there are the managed care organizations, Kaiser, Veterans Administration, et cetera, and privately owned cancer clinics, which I favor. I actually prefer a privately owned cancer clinic, and I'll talk about that later. But the one my wife and I go to, we actually have the same oncologist. We have the family oncologist. Her name is Diana Superfin. And I asked somebody once, she's Ukrainian, whether she made up the name Superfin. And they told me, no, she made up the name Diana. I don't know what to think of that. But the clinic we go to is very well integrated and equipped. They are affiliated with the local regional hospital, which is John Muir. And John Muir is affiliated with University of California, San Francisco designated cancer center. So they got the best of all worlds. And they're building a big cancer center, literally 10 miles from my house between the two different hospitals. So let's talk about choosing the ongoing cancer clinic. And, you know, the thought here is that you have a chance to upgrade. This is where you are. If you're happy with where you are, great. But let's talk about some logical criteria for making decisions of whether you do want to upgrade and where you could go and how you could do it. So first, the oncologist and the clinic are an integrated whole. If the clinic doesn't work, the oncologist can be terrific, but your insurances can get messed up, your prescriptions can get messed up. You know, people don't answer the phone, you know, the appointments are slow, things don't happen. The oncologist may be brilliant, but if the clinic isn't great, that's a whole nother story. You can ask around to the people in the hospitals, you know, where you're getting your scans and everything else, as to what are the great clinics around? Where would you go if you were a cancer patient, and what clinic would you attend? And they know where the competent people are. A lot of those folks, you know, move around quite a bit, and they know where they want to work and they know where they don't want to work. The doctor's assistants are really good with that. And the hospital nurses as well, and of course other patients. But there'll be standouts where you live and places to avoid if you really do shop it, that'll, you know, stand out to you, and there might be something appealing there that could allow you to upgrade your service. And do they, of course, have an experienced lung cancer oncologist? Maybe ALK experience, maybe not. Maybe they're not a lung cancer specialist. There isn't a lung cancer specialist. Maybe there's a really smart, efficient, well integrated with the clinic oncologist that's very, very sharp. So our favorite oncologist, Diana Superfin, is a generalist. She happens to be brilliant. She doesn't know everything. There's no question about it, but she knows what she doesn't know, and she's willing to accept second opinions. And she's extremely efficient with our treatment plans. And we love her, and she loves us, quite literally, which is really quite nice. So, you know, it'd be better to have an ALK expert in an integrated clinic that's right close by, but maybe not. And then when evaluating a local clinic, our chemo patients treated on site, this goes to the comprehensive nature of the local clinic. You know, if they're treating chemo patients, you know, you're not just going to a doctor's office. That it tells you they're doing bigger things, and perhaps they have pharmacy services on site as well. They provide your drugs for you. And it's really nice to have blood draw in-house. Our clinic has an insurance advocacy representative, and I'm going to click down, that's really good at arguing insurance issues. So I just got turned down for a new cholesterol drug, and I'm sure Sean's going to fight it out for me. And he's a friend now, and it's great. But he's also really good at applying for co-payment support and free drugs from the drug companies. So my wife and I are retired. We've been retired a long time. Our primary income is Social Security. We don't show a lot of income on our tax returns. And he's managed to get us free drugs. She gets hers from Lilly. I get mine from Pfizer. And all we showed were tax returns. And, you know, if you don't know that's available, you can do it yourself through the drug companies. If perhaps you're not working or showing low income, it's an opportunity. But a good clinic will have somebody who can do that for you. Again, the front desk people are very important. Are they competent, engaged? Do they know your name? Do they answer the phone? Are they connected? Well, let's drop back here for a second. So I go to University of San Francisco, UCSF, University of California, for my prostate cancer treatment. I sit in the receptionist is behind a bowl of fruit glass. I sit in a waiting room that's like a football field. And they give me one of those vibrators when my number is called. It scares me to death every time, you know, sitting there in your pocket. That's pretty cold clinical experience. When I go to my local oncologist, I walk in, they're happy to see me. You know, I've been around for 8 years now. They're delighted to see that I'm still walking upright. And they joke around. They're nice. They're nice. They're just nice people. There are 2 big aquariums there, and there's some really sick people, unfortunately, in this waiting room in the clinic. And they do the chemo in the back, and they have the blood draw right there. So you know, there's a big difference in the two. Now I'm going to UCSF for the prostate cancer because it's once a year, and you know, my local guy I had to fire. So that's just the way it goes. Do they answer the phone? That's a really big thing. You know, if you can't get through to anybody and you're worried about something and you're trying to get a scan scheduled or you're trying to get a report out and nobody answers the phone, you get an answering machine and nobody calls you back. That's tough to have a clinic like that. And of course, are they connected to a larger transparent medical care network? My chart kind of thing where other doctors can see everything that's going on with your treatment plan. Choosing your practicing medical oncologist. Now, this is, I'm going to draw the distinction between that and the second opinion oncologist. And how do you choose, you know, a local medical oncologist? Again, the oncologist works for you. You have the right to make the choice. Are they a generalist or a specialist? And I would ask, do they have any other ALK non-small cell lung cancer patients? How many? How are they doing? Diane has, well, she has 2 left. 1 passed away. Are they competent? Do they pay attention to your stuff? When you walk in, do they remember all the different details? Are they, at the end of your sessions with them, are they efficient at planning and then following up and working the plan? An oncologist needs to be competent. And that, I think, you know, if you're using a second opinion oncologist, then your local oncologist, to me, the primary criteria is competence. How long they've been in business, of course, background in education. Do they accept new information from you? You know, not all human beings can be told by the patient that, you know, here's something you don't know. Do they encourage second opinions? And this is something that may need to be cultivated, again, diplomatically. Can you communicate with them by email or my chart? You know, that's very important. Do you get, if you send an email, do you actually get an answer? That's important to consider with an oncologist. Do they actually listen to you when you describe things? And do you like them? And do you trust their interest and their judgment? On the ball for blood tests and scan scheduling, that of course goes to competence of both the doctor and the integrated clinic team. Do they integrate well with the clinic team? We have one doctor who happens to be the owner of the clinic that nobody likes. And they're always complaining about the poor guy. Whereas with Diana, they bend over backwards to do anything they can for her. There's a difference. And this might be too much to ask for, but is there kindness and empathy in your oncologist that's, talk to a lot of people every day? Can you get an immediate appointment when something comes up? Do you have to wait 3 weeks if you got recurrence? We certainly see people that are waiting and waiting and waiting for appointments when, the moment has come. So this is the biggest theme of my talk, and it sounds like a whole lot of you people understand that most important thing you can do to ensure extended survival is get a second opinion non-small cell lung cancer ALK specialist. They are available, National Cancer Institute designated cancer centers. Many have those second opinions. It's usually a pay to play. I have experience with 3 of them. One, when I went to Mass General, my insurance paid for everything. I went there. I did a remote several times with Ross Camage, and I paid for it. It was $750 the first time and $250 the following times. And I've heard that that's common, but certainly your mileage will vary. And then there's the ALK Second Opinion program. I'm watching my time, Mark. So this is back on the same page that Mark was introducing previously under patients, second opinion program. If you can't afford your second opinion, then there's a program within the organization to help you pay for it. It used to require that you belong to the support group, but not anymore, I'm told. And these are the second opinion doctors who I'm delighted to say are all of the leading lights in ALK non-small cell lung cancer. And for those of you who are considering getting a second opinion, these are the folks that are doing the research. Some of your better doctors in the National Cancer Center, your more informed doctor will certainly be studying and reading the research. And then many of the doctors that are generalists in the communities probably don't know about the research or might not know about the research. They've got too much to do. So these are the folks that really know the cutting edge of what's happening in the science. And the paradigms change. I mean, they can change every 6 months. There are different things that come out that are working for people, different combinations of local consolidative therapy and TKIs, et cetera. There are things that happen that don't really trickle down for years to the local communities. And these are the scientists that you can connect with directly. And that's, again, just a wonderful treasure for us that has been developed by the ALK positive medical teams, much to our common blessing. Ken, I noticed you're on here. Could you talk about the list you're working on for experienced oncologists?
Yeah, thank you so much, Jeff. Great presentation. We are, as a part of our medical committees, we're working on trying to get a list of ALK experienced oncologists around the world. We now have about 427 on there. The definition of ALK experienced is still it's still under discussion. But I think one of the things we want to do for the whole ALK community is help provide additional guidance along the lines of what Jeff is proposing tonight. Anything else on that topic, Jeff?
Nope, I think that'll do it. Thanks. Appreciate it.
My pleasure.
So a few of the other people you may encounter along your pathway, certainly a thoracic surgeon does biopsies, larger lobectomies and pneumonectomies. They're specialists. Surgical oncologists do biopsies outside the chest, tumor resections and dissections. They may work for the hospital or an independent doctor group, but normally they'll operate, particularly if it's a thoracic surgeon, they'll operate in the hospital. Biopsies might happen in a surgery center. In my experience, they're often identified by the oncologist, but I asked around for my biopsy early on, and I wound up with the head of John Muir Hospital's surgery group, a woman by the name of Michaela Strasnicka. We have a lot of characters here in California. And Michaela Strasnicka is 6'4" and wears 6-inch spike heels all the time. You can hear her coming a mile away. And she has pictures of spike heels all over her walls. And at the bottom of her building, she owns the coffee shop. It's called Mickey's Mocha. And she's a terrific thoracic surgeon, and we do love her. Radiologist, for those that don't know, is an individual that reads the scans, interprets the results, and provides diagnostic information. This is the individual's little name shows up on your PET scan or your CT scan. And I was recently advised by one of our medical committee members to get my own radiologist, because in our network, there's a different radiologist reading the scan reports, the scans themselves, and creating the reports pretty much every time. I mean, I don't see the same name repeated. They're very thorough and they seem very, very good, and they go back through the old scans. But he suggested that there's a higher level of radiologist out there, and that the assigned radiologists sometimes miss things. Well, take that with a grain of salt. Radiation oncologist is a doctor that, in my experience, does the radiation treatments, orders my PET scans, my brain MRIs, and recommends on all of the planning, all that, in collaboration with my oncologist. I think it's important to know who your radiation oncologist is if you haven't encountered that individual. A lot of the oncologists order these scans themselves, and the MRIs themselves. If there's a radiation oncologist in your clinic network, it would be good to know them, because when it comes time when a progression might occur, that individual's be good if they knew you and knew your case. If you haven't encountered them already, it's just good for planning ahead and getting ahead of the game. The pathologist shows up from one of the professional services that they send your biopsy out to, or if it's done in-house, their name will show up on the report that says you have ALK positive of this, that, or the other type. Comes out of your biopsy tissue or blood draws or pleural fluid. The pulmonologist is a lung doctor. I came in to the cancer community through a pulmonologist because I was having trouble breathing. And that's who you go to for trouble breathing or pleural effusion, etc. Or the effects of radiation or surgery. If you're having trouble with your bronchioles or whatever, pulmonologist is the kind of doctor you go to. Heart issues, cardiologist. This is important right now for me because I can't tolerate the statins that control the cholesterol that I'm on, lorlatinib. I've been on it for 2 years, and the muscle aches and pains are kind of tough. So we need a cardiologist in the middle that really knows the new drugs that have come out that are not as side effect laden and are actually more potent than the statins. So, we just tapped a cardiologist, and I was delighted about that. Palliative care providers, we've had palliative care provider, a palliative care provider, ALKtALK. And I don't have much, if any, I have one meeting with one of these providers at our hospital. The thought is that they're really for people on their last legs and help the families in certain transitions. But the case has been made that they're very, very useful for people that need help just managing cancer, which is not easy, as we all know. I suggest for those of you who have neuropathy or joint pain or muscle pain, to talk to a pain management doctor. There are pain management specialists out there these days that have wonderful treatments that really work. I use one. She gave me some medication that I take every day that works terrifically and doesn't mess my head up any more than lorlatinib does. But they're usually covered by insurance. They're specialists, independent, and they have some tricks that you wouldn't encounter necessarily directly from your oncologist. And getting ready to wrap up. Mental health support is very important for assembling your care team. And of course, there's therapeutic counseling. Cancer management is not easy. And we all go through some rough things. There's no two ways about it. And having a professional that knows you at your beck and call to talk to when you need it is really critical. I mean, it used to be stigmatized that, nobody wanted to go to counseling, etc. But it's not like that anymore. And I can say from personal experience, I've been with Roberta since my 30s, which is 40 years now. And we know each other so well. And when I'm having difficulties, I'll call Roberta. I come out of it laughing with a game plan. So I much encourage everyone to tap their therapeutic counseling if you feel so inclined. And it's one of those assets that we have and the insurance companies will pay for. That's very, very valuable. And in my view, my opinion, not to be wasted. Of course, there's the ALK Positive Patient Support Group on Facebook. Questions. People are on there creating family, creating friends, creating a network. And if you have questions, whatever, you're having trouble dealing with something, that's the place to go because everybody's going to understand you. That's for sure. The activities that Summer and Mark create are another one of those treasures that we have that just very rare. Caregiver and partner as part of your mental health support. I don't know how single people that live alone manage dealing with cancer. I can't imagine. I mean, one of our first doctors, when I got sick, looked at Ellen and I and said to me, "You have a major advantage." And I said, "What's that?" He said, "You have her. I can't tell you how many people come in here by themselves." And Ellen and I support each other in a way that we never could have learned to do if it hadn't been for cancer itself. Because one of us is always going through something. And you need to be there to support them with love and affection all the time. And to show up for your care partner in a positive and contributive way. And there's another treasure there in learning to be there for your partner, just as they're there for you. So to me, that's the biggest advantage that both Ellen and I have for our mental health support that anybody could ever have. And we've gotten good at it. All our friends call us lovebirds. You know, we don't fight, we don't argue, we don't have any friction. We understand each other, and we earned that from dealing with each other's cancers. So maybe there's a lesson in that for everybody. And of course, family and friends, same thing. You know, some people don't want to tell their families what's going on. I don't necessarily agree with that. That's my opinion, but sustaining your family and friends while you're dealing with a lot of tough stuff can be hard, but it's critical. You know, keeping that network together is what it's all about. And of course, you know, getting back out there if you have to get back out there. COVID locked us all in the house for quite a long time. And I would say use that aggressive nature to pull yourself out if you need to. And then, of course, there's the old positive attitude. Set a place at the table for fear. Some of the people on this call will recognize where that came from, but we're all afraid. I mean, if you're not, there's something wrong. And things happen, they scare you. 4 o'clock in the morning, you wake up, what if? And it's just part of what happens. You know, you get to know it and accept it for what it is. For me, the fear has been the worst part of the whole cancer. You know, I can put up with anything pretty much, including the radiation burns, but it's the fear that really can get to me. And over time, it still happens, but I don't care, you know, because I'm so familiar with it. You know, it happens, okay, and I get past it. So, you know, it's kind of like a member of the family now. And the more you get to know it, I think the better you can do. Dwelling on bad outcomes is bad for you. I mean, ruminating on the worst thing that could possibly happen is deadly and creates fear. And of course, we could probably do a whole session on this, replacing the downward dwelling with imagining the best possible outcomes and practicing that. So I have this mantra, it's just one word mantra, is survive. Do what you need to do to survive. Make up your mind you're going to survive this, and you'll do whatever it takes to ensure that. Now here I'm going to talk about belief for a minute. I believe that the determination to survive, no matter what it takes, resonates through every cell in your body, and that your body hears you. If you really say to yourself, I am going to get through this every day, multiple times every day, your body knows it. And who knows, maybe the immune system kicks up because of that, whatever. But it's darn sure that you're going to feel better for it, because you learn to know that you're going to survive. There's a place inside you that says, yeah, I'm going to make this. I'm going to get through this. I've convinced myself. And it's useful. It's a much more comfortable place to be. And then Ross Cabbage's stay in the game. Just stay alive, stay in the game, survive. New treatments are coming, and they are. I get to see everything on the medical committees and really get an interesting view of the University of Michigan. And I could tell you there are breakthroughs just waiting to happen, or have already happened that we haven't heard about yet, or some of us haven't heard about yet. Just hang in there. And of course, appreciate the miracle of life. We're talking about a positive attitude. It's springtime here in California. Everything's green. It's beautiful. We forget that this life is a miracle. And of course, gratitude. It's impossible to have a bad attitude or pessimistic attitude when you're dwelling in gratitude. That's just reality. And then, of course, the best thing you can do for yourself, other than align your second opinion, is help somebody else and pass on love and support. I was talking to Mark, my new friend, good friend, Mark Rosenzweig, yesterday.
Oh no.
Yeah, here it comes. And he talked about how happy he is in his cancer life because of the activities he's involved in, reaching out to other people and supporting other people and passing on the love that they give him. And he talked about the joy he gets from doing his advocacy and patient support. And I could speak for the same thing. You know, I do some volunteering. I attend a lot of stuff. I do some writing for the patient group, and everybody seems to love it. And I get a lot of joy out of that. So here I am, working through cancer in my way and finding joy and appreciation and gratitude that I never really had before. So, reaching out for other people multiplies itself and comes right back on you, which I'm sure all of you know. I don't have to tell you. And with that, I'll say thank you, stay well. And if we have any questions and time left, I'm happy to take them.
First of all, you did a great job. And second of all, I'd say half of the questions are basically compliments. So you did a great job, Jeff. Thanks so much. I'm going to rip through some of these questions really quick. If you do see an ALK specialist already, do you recommend seeing a second ALK specialist? Which is interesting because I do know people who do that and they get different opinions. So what do you think?
Yeah, Jessica Lynn will give you a very different perspective than Ross Kamich. And I think they might both give you a different opinion than Suresh Gadgil. If you really want to do that, do it. And if you can afford it and make it work and can do the traveling, perhaps, yeah, why not? Particularly if you're at that critical moment, where you really need a whole lot of feedback, and maybe you just progressed on lorlatinib and you really do need multiple options. Sure.
So Ken, what would your opinion be? Do you go with your gut feeling? I mean, if you might have 3 ALK specialists, and we might give you 3 different opinions.
It's tough. And Mark, in many of these cases, there isn't a known right answer. So I think I was just at the lung cancer meeting in Copenhagen this week, and what the ALK specialists were saying is they want to make the decision with the patient. So if the patient's going to be part of the decision making, the patient's going to have to be educated, as Jeff said. So but there has to be a treatment plan based on the current information, and it has to be updated along the way, Mark. So maybe you're not seeing 3 specialists at one time, but one of the advantages of having ALK positive lung cancer is you do have time to investigate and keep up with the changes that Jeff was alluding to. Jeff, I hope I'm not contradicting you. I'm not trying to.
No.
Okay, so it kind of, if you had to take away from Jeff's approach here, what would you say is one of your takeaways that you would take away as a patient?
I'd say there's time to plan. If you don't plan, you're planning to fail. And there just might not always be a right answer. So keep asking the questions, because things are not static. They're always changing. And there's no way, and at one point I could ever summarize Jeff's brilliant presentation, Mark.
I put you on
Nice
the spot
try.
there. Are you still in Copenhagen, by the way?
No, I got back last night.
Okay, good. We have a lot of comments about the Canadian health system. I know Ken, being traveling across the world, how do we attempt to bridge the gap between the US and other? This is a whole nother ALK, but I mean, that's what you're trying to do, right?
But it would be great to have someone from Canada come. There are programs in Canada that are specifically for people in special circumstances to either go to another province where they might have special things, or to come to the US. I don't know them, but I know they're available. And sometimes they take time to get the approval for. So again, it's really important to be proactive and searching out the answers to these before all of a sudden it's an emergency.
Side effects, which type of doctor would you go to? I don't personally go to my oncologist for side effects. Jeff, how would you deal with that?
Well, I use the pain specialist because those are the side effects that I have. She's done a couple of nerve blocks. for leg pain, etc. A good GP that has a pain specialty can be very, very useful. A neurologist, for headaches or other kinds of things.
And palliative care. They're all about comfort care, helping you live your best life. So better to see them even before you need them, get a baseline, get on their radar, and they can help with all of that for sure.
A
Fatigue.
lot of these insurance questions and stuff.
Mark, can I add
Yeah.
one thing to that? Again, this
Absolutely.
came up last week at the international meeting, and that is that you need to know what the common side effects are to the medicine you're on, because in some cases, the ALK specialist is going to know how to manage those drug-related side effects. That means you won't have to go down on the dose, only if you need to go down on the dose. So it is great. To me, it depends a little bit on making sure that it's not, if it's drug related, you're getting the right advice on how to manage the side effect from the drug.
Very good. And I know we've spoken to a palliative care doctor on an ALKtALK, and we're going to try to bring in hospice and look at the two of them in some type of a panel. The other thing too, I want to foreshadow on May 7th, we have cancer finances discussion with triage cancer. So some of these questions I think come in through the chat where finances related with insurance. And Jeff did mention in his talk that I think it is important. My cancer center has I guess it would be a social worker that handles finance. So that's a very tricky situation to cover. So Summer, you had a couple of comments too that you wrote down.
The palliative care, I just wanted to make the clarification about that when we did have Dr. Petrillo on, and then she was at the summit last year too, she really pushed like living, buy the shoes, buy, invest in yourself, live your best life. So that was my palliative care. And then the other point, Jeff, you made a few great points about specialists and who you might need to see aside from an ALK specialist, neurologist, cardiologist. And that's something too. I've had friends start lorlatinib and see their cholesterol levels shoot up. We know that happens. So why not get a cardiologist on care before you're, needing to have fluid around your heart drained or something like that? Why not see somebody if we know that there's going to be those issues to have you at a baseline? So I think being proactive with specialists is definitely a way to go.
There's another question here that you brought up, Jeff, in your presentation. Having your own radiologist. I do look at the names on the bottom of my PET scans and CT scans, and they're all different names. So, and this is a question also for Ken. I've never heard of that before, but that makes a lot of sense to me, to have one person looking at your scans versus all these different other opinions. So Ken, from a doctor's perspective, oncologist, what's your thought?
Well, Matt Quirk, who's a member of our committee and is a radiologist, would be better to ask than that. I will say that in our clinical trials, we use the same machine for the CT scans, not the one, a different one. And we use the same radiologist to read them all to try to take that variability out. I don't know if Matt's on the call tonight, but he would have a better answer than I do.
Okay. Any other final thoughts, Jeff or Ken, Summer?
Just thanks to everybody for all the wonderful comments. I haven't done any public speaking in a long time, and it's nice to know that the old fastball still works.
It does.
I'm going to throw you a curveball here and say this. Mental health. We've done some ALK on mental health. People, I'm telling you, it's a very big component to staying healthy mentally. And Jeff's final couple slides hit home for me. Jeff and I spoke for about an hour the other day about how we keep ourselves, quote unquote, in the game mentally also, because we do live every day and we live with our spouses and family members and friends. It's very, very important to take care of that. See a psychologist, join on to one of our weekly meetings. I think you'll make some friends very quickly. So, and Summer, you want to talk about the next ALK Talk?
Sure, yes, and just piggybacking on what Mark is saying right there, with our Healing Arts calendar. A lot of time goes into planning those, and Dana Quirito is a huge part of that as well. She's hosting the next ALK chat on Wednesday at noon, so if that's something you might be interested in, you could come on, meet people. But there's different events at all different times, as my dog just walks into the room, sorry. Anyway, so definitely check out the Healing Arts calendar to see what might be a good fit for you. It's worth it to, you know, even if you're at work, try to take your lunch at that time or something like that. Okay, then also our next, you have a 2-week break, and then we have our next ALK Talk, like I mentioned in the beginning, understanding cancer lingo, what does it all mean, with Colin Barton, and then he's preparing us for the following week on the 23rd. I've progressed, now what? So part 3 and part 4 in our ALK Talk series. So those are coming up. Also, this will be posted tonight, tomorrow, shortly on our YouTube channel. Go ahead and subscribe to the ALK Positive YouTube channel. That way you'll just be alerted as soon as something posts. So that is a huge help. I think that's it. Thank you all so much for coming. And again, those classes are created also based on your feedback. So at any time in the newsletter, there's a link to Mark and I through ALK Talk, but you can always give us ideas. It's also in the Facebook group. We had one member that brought up a book club and she started that. So we have so many volunteers working on different things and we're so grateful for all of them. For me, this is my therapy outlet. Helping is my mental health. So yeah.
Thank you, Jeff and Ken, for coming on. But Jeff did all the heavy lifting.
You're welcome.
Really, really appreciate it. So
Yes.
guys, gonna mute and give your love to Jeff.
Thank you.
Thank you very much.
Thank you, Jeff.
you.
You're welcome,
Great
everybody.
job.
Stay
Thank
well.
Great job, Jeff.
Thank you.
Great job.
Thank you.
Thank you.
Thank you.